Hi everyone, am I audible and visible? Okay, hi everyone, am I audible and visible, guys? Okay, good evening, everybody. So this is going to be a short series where I'll be putting out 40 to 50 PSM MCQs. Okay, most important for your upcoming, this it'll also help you revise your FMG topics, like the topics that you need to know for PSM for your upcoming FMG exams. Plus, it will like give us a thorough overview of the subject also. Okay, guys. So before I begin, please remember there is an offer which is going on. Get 23% off on all Unacademy NEET PG subscription. So if you want, you can definitely subscribe and you can use my code PSM10 for any of the subscriptions on Unacademy. You can use my code PSM10, guys. Okay, so that's one thing that I wanted to tell you. And also now we have launched a NEET PG Vitals, guys. Okay, which is a recorded video session for comprehensive NEET PG preparation. So you're going to get it's now you're going to get all the you're also getting access to the recorded videos helping in your comprehensive NEET PG preparation. Okay, so this is the special launch price that you can avail, and do subscribe. It's going to be these are your wonderful educators who have recorded the videos for you on the Unacademy platform. So again, you can avail this offer by using my code PSM10. Okay. Also, there's a final summit batch, and other PYQ batch has also been launched, which is currently going on. So you can again subscribe and become a part of it. Okay, for any of this you can use my code PSM10. All right, so that's it. Let us begin the first question for today. Okay, thank you so much. Let us start now. So it will be quick sessions of 30, 35, 40 minutes max, where we're going to look at 40 to 50 PSM MCQs most expected in your FMG exams. Okay, so this is the first part of the class. So can you give me an answer for this? True about quarantine, restriction of movement of infected patient, restriction of movement of healthy contact of an infectious disease, movement restricted for shortest incubation period, or isolation of diseased person. Very good. So this is a very, very important topic. Okay, it is about quarantine and isolation, guys. Okay, so I just wanted to revise this topic once on quarantine and isolation. ठीक है. So this, of course, the answer is B. Now, restriction of movement of infected person, it's never quarantine. Always remember, is done for a contact. Okay, quarantine term is always used for a healthy contact. It's never for a patient. Okay, and it's never done for the shortest incubation period. It is done for the longest incubation period. Okay, so let us quickly do a difference between quarantine and isolation. Okay, what is the difference between quarantine and isolation? Let's quickly do it. So quarantine is done for whom? Quarantine, number one, it is done for healthy contacts. Okay, and isolation, everybody, is done for what? Isolation is done for cases. You always isolate the cases, but you quarantine the contacts, but you isolate the cases. Okay, so quarantine is done for maximum incubation period of the disease. Okay, it is done for maximum incubation period of the disease. All right, maximum incubation period of the disease. And this thing is also known as absolute quarantine. This was also asked in your exams. What is the absolute quarantine? Okay, it is that quarantine is restriction of movement for maximum incubation period. Okay, restriction of movement for maximum incubation period of the disease. Isolation, till when do you isolate a case? for the period of communicability, okay, for the period of communicability, or for the period of transmissibility. Am I not audible, Mukesh? Everybody, am I audible, guys? I hope you can hear my voice. All right. So isolation is done for the period of communicability or for the period of transmissibility of the disease. Then if I ask you quarantine, it is which? नहीं आ रहा आवाज एक सेकंड. All right. Now is it okay? Now is it all right, everybody? Okay, should we continue? All right, let's continue. So, quarantine is which level of prevention, guys? Quarantine, remember, it's for healthy contact. So, it is primary level of prevention. Okay, it is a primary level of prevention. And what about isolation? Isolation is for the cases, right? So, it's a form of treatment. So, isolation is secondary level of prevention. Okay, quarantine is primary level of prevention and isolation is secondary level of prevention. So wanted to revise the difference between quarantine and isolation, which we have done. So your answer here was true about quarantine is restriction of movement of healthy contact of an infectious disease. Okay. All right, next question. Can you mark this? Again, levels of preventions are equally important for any of the exams. So you will definitely get a question on that. Primary prevention aims to prevent disease or injury before it even occurs. Okay, so primary prevention in MI are all of the following except. So what is your answer? Maintenance of normal body weight, change in lifestyle, change in nutritional habits, or screening for hypertension. So what is the answer over here? If I ask you primary level of prevention, very good. Screening everybody is which level of prevention? It is secondary level of prevention. Screening is always done to make an early diagnosis. Like the person is not presenting with signs and symptoms, but we want to find the disease before the person goes on to develop signs and symptoms so that we will be able to provide timely treatment and prolong the survival. Okay, so here maintenance of normal body weight, change in lifestyle and nutritional habits. These are all primary level. But is it health promotion or specific protection? What is it? Is it health promotion or specific protection? Maintenance of normal body weight, change in lifestyle, change in nutritional habits. Very good, Alia. So all of these, everybody, if you maintain a healthy lifestyle, if you change your nutritional habits, all these things, it's going to protect you from a lot of diseases, right? So this is an example of health promotion. Okay, all right. Vaccination is specific protection, Nani. Okay, vaccination is specific protection. So let's just revise it. See, there is one primordial level. Okay, primordial level of prevention is before risk factors. That means I will not let you smoke or I will not let you start drinking. Okay, so primordial is before risk factors. What is primary level of prevention? So primary level of prevention means the risk factor is present, okay, but disease not started. Okay, risk factor is present but disease has not started. Secondary level of prevention means what? Disease has started, okay, but there are no complications. But no complications meaning that we can still reverse the disease. Okay, it's still possible to reverse the disease. And tertiary means what? Tertiary means the disease has progressed. Okay, Disease has progressed to a stage of irreversibility. Irreversibility. And are complications present? Yes, complications are now present. Am I clear, everybody? Okay, so this is very, very important. And how do you achieve these levels of prevention? What is the mode of intervention for this? That can also come. So to achieve primordial level of prevention, we do what is known as health education. To achieve primary level of prevention, we do what is known as health promotion and specific protection. Okay, health promotion and specific protection. For secondary level of prevention, it is to do an early diagnosis, okay, and treatment. Do an early diagnosis and provide treatment. For tertiary level of prevention, it is what? Disability limitation, okay, it is achieved through disability limitation and rehabilitation, okay. So just a quick revision for all of you. Now, if I ask you screening is a way of early diagnosis, okay. So secondary level was screening, okay. So just a few examples. Vaccination, which level of prevention is it? Vaccination, which level of prevention is it? Why do you vaccinate a child? So that the child does not go on to develop the disease. The risk factor might be present. Very good. So vaccination is primary level, or you could also say it is what? Specific protection. Okay. All right. But uh, if I ask you, okay, very good. Providing crutches for polio. What is this? Crutches for polio. So providing crutches for polio. What level of prevention is this? Providing, yes. If you use BCG vaccine for treatment of bladder cancer, it becomes secondary. So crutches for polio, that means complication is already there. So it is tertiary. Now the person would be able to walk. So is it disability limitation or rehabilitation? It is rehabilitation. You can make the person a part of the community again. So providing crutches for polio is tertiary level of prevention or rehabilitation. All right, a few more. If I say prevention of childhood obesity. What is it? Prevention of childhood obesity, guys. What is it? Prevention of childhood obesity. Prevention of childhood obesity. What is this? If I say prevent childhood obesity, is it primordial, primary, secondary, or tertiary? Very good. This is primordial because over here, all right, over here, preventing obesity. Obesity is a risk factor, guys. So, in simple words, we want to prevent the risk factor. Okay, so prevent the risk factor is your primordial level of prevention. One more, smoking cessation after heart attack. What is it? Smoking cessation after heart attack. After heart attack, if you quit smoking, tertiary में कौन सा है? Tertiary may tell me, of course, heart attack has already occurred, so complication has already occurred. But is it DL or is it rehabilitation? When you stop smoking after somebody has suffered from a heart attack, it is an example of DL. Further limit the disability. Okay. So all you need to do is you have to see whether risk factor is present or not. Okay, whether disease has started or not, complications have occurred or not, and accordingly you can mark your answers. All right, okay, let's move to the another question. Yes, the chapter of sociology is very, very important. Role of social factors in disease causation. What is this? What is the answer to this? Spectacles. Spectacles is what? Spectacles stabilize your vision and provide visual clarity, Alia. So spectacles is an example of tertiary level of prevention. Okay. All right. Role of social factors in disease causation is social pathology. Sociology has come last time also. Okay. They definitely ask you the definitions. So let us revise some definitions. What is sociology, everybody? What is sociology? What do we do in sociology? It is the study of human relationships. Okay, it is the study of human relationships, and it is also the study of human behavior. Okay, all right. What is social structure? Here you can see what is social structure. What is social structure, everybody? So social structure means pattern of interrelationships among members in a society. Okay, pattern of interrelationships among members in a society. That is what is social structure. One more thing, social pathology is social causes leading to the disease occurrence. What is acculturation? Most expected from in FMG exams also. Acculturation क्या होता है? Anyone? What is acculturation? What is acculturation? So if you talk about acculturation, guys, it is nothing but cultural contact. Very good. Or it is exchange of cultures. ठीक है? It is cultural contact, or it is also exchange of cultures, like during marriage, trade and commerce, education, we go to study abroad. All right, then conquer of a country by another country, that is acculturation. One more thing. What is this? Fill in the blanks. The first one, learned pattern of behavior, which is socially acquired. Very good. So, learned pattern of behavior, guys, is culture. An established pattern of behavior is what? Established pattern is customs. Okay. In customs, again, you have two kinds of it. Okay. Folkways and mores. So, mores, M stands for mores means more stringent customs, and folkways means what? Less stringent. Okay, folkways means less stringent and mores means more stringent. Please do revise all the definitions from sociology. It is equally important. Okay, all right. Okay, moving to the next question. What is the answer to this? If wide range of values are present in a community, then the best measure of central tendency, this has come last time also, it's a very repeated topic. So what is this? Wide range of values are present in a community. What does this mean? What do I mean by wide range of values? Wide range of value means what are present? Outliers. And outliers make my data skewed. So all I'm asking you that what is the best measure of central tendency for skewed data? Skewed data. So what is it? Yes, it is median. See, mean, median, mode are measures of central tendency. Standard deviation is not the answer because it is a measure of dispersion. Okay. So whenever you have outliers present, it makes your data skewed. And the best measure of central tendency for skewed data, everybody, becomes median. All right. Overall, if somebody asks you, okay, suppose I've given you a data like this. Which is the measure of central tendency you would want to use for this data set? Anybody? Look at the data. It has 20, 18, 22, 24, 32, 36, and 37. So which measure of central tendency would you use over here? Why mean? Why mean? Because statistically everybody, okay? Okay, statistically, all right. Statistically, if you talk about statistically, the best measure of central tendency, everybody, is mean. Okay, and mean का formula क्या होता है? What is the formula? It is the sum of all observations. Okay, it is sum of all observations divided by the total number of observations. So statistically, it is the mean. It includes all the values. Look, 2018, 22, 24, 32, 36, 37. This data appears to be in a normal range. Okay, there is no outlier over here. ठीक है, इस data में कोई problem है ही नहीं. But in case I gave you the data, okay, what will you use over here? Now look at this data set. Look at this data set. The values are 200, 300, 320, 120, 5,000, 400, 500. Now, is there any problem in the data set? Yes. Instead of 500, we have what? 5,000. Maybe I was supposed to write 500 or मैंने क्या लिख दिया? Maybe I was supposed to write 500 and by mistake I wrote 5,000. So this does not seem to belong to this data set. So this is what? This is an outlier. And whenever you have outlier, it is going to make my data skewed. And best measure of central tendency for skewed data set, everybody, is median. Remember, outliers are what? Outliers can be too high or too low values. Okay? Outliers are too high or too low values. Okay? So this makes my data skewed and therefore the correct answer to this is median. If somebody asks you most affected measure of central tendency, most affected measure of central tendency for skewed data, what will be your answer? Most affected measure of central tendency in skewed data. If you have a skewed data, which measure of central tendency is the most affected? Very good. So there the answer is me. All right, but the best measure of central tendency in skewed data set is median. All right, so the question was wide range of values means outliers. So the data is skewed. So what is the best measure of CT over here? Median. Okay, thumbs up everybody. Let's look at few more questions. Yes, one of the most expected topics these days, everybody. Chalo. Dispersion डॉक्टर जे होता है स्टैंडर्ड डिविएशन रेंज mean deviation standard errors. Okay, if you want to have a detail look at that, okay, there's a video of mine also on Unacademy, you can refer to that. I'll try to bring one question on dispersion in the coming classes and revise that with you. Okay, all right, now please don't forget this question. All follow open while policy except. Now this question is continuously coming in your exams for the last 3 years. Okay, so it's very simple. I'll give you a mnemonic also for that. But before I give you the mnemonic, remember one thing. Whenever you talk about vaccines, okay, how are the vaccines available? The vaccines can be available in the powdered form or liquid form. Now, can you inject a powder? Can you inject a powder? We can't inject. So to them we add a diluent. Okay. And when we add a diluent, this is known as freeze-dried vaccines, lyophilized vaccines, or reconstituted vaccines. So what are the vaccines that you have over here? The ones in which we have to add a diluent and make it a freeze-dried, lyophilized or reconstituted ones, guys. Here, what are the vaccines that you have? You have BCG, you have measles, very commonly asked, measles, rubella, Japanese encephalitis, yellow fever. For BCG, sodium chloride or normal saline is the diluent. For measles and measles rubella, it is what? Distilled water or sterile water. For Japanese encephalitis, it is phosphate buffer. And for yellow fever, it is cold saline. Okay. So BCG measles, you can use it up to 4 hours. Japanese encephalitis up to 2 hours. And yellow fever, you can use up to half an hour. Alright. Okay. So you've done one more question over here. They definitely ask you the diluents also for the vaccine. So we have covered that. In the liquid vaccines, you always have, please remember, the T series vaccine. Okay. T series means, T series matlab जिनमें letter T है. All those vaccines which have letter T in it. So what are those vaccines? Like hepatitis B, DPT, pentavalent, TD. Okay, these all have T series. Also, you will remember PO. Liquid matlab PO. So P for PCV, IPV and OPV. These are all liquid vaccines. Okay, so T series vaccines plus PO. Now, what is open vial policy? See, open vial policy. Okay, open vial policy. It simply means that once the vaccine vials are open, you can use them up to 28 days provided they are maintained in what? They are maintained in proper cold chain condition. And if I ask you which vaccines follow open vial policy, so the question is vaccines that follow open vial policy. So what is the mnemonic for this everybody? एक हो गया T series vaccine plus PO. Okay. So all the T series vaccine, P for PCV, I for IPV and O for OPV. So T series plus PO. PO is liquid, so they follow open vial policy. And again a question which can come, vaccines that do not follow, okay, they do not follow open vial policy are the reconstituted vaccine. So here BCG, measles, rubella, all right. What else? Japanese encephalitis, okay. Anything else? You just did it, yellow fever. And if you will see, they also ask you a question on rotavirus vaccine. Okay, so rotavirus vaccine, all right, rotavirus vaccine also does not follow open vial policy. Please remember that, okay. Rotavirus vaccine also does not follow open vial policy. Okay? So this is a very commonly asked topics which is coming in your exams nowadays. Please don't mess it up. Which vaccines follow open vial policy? So the mnemonic is T series plus PO. PO say liquid. Yes, most common complication with rotavirus vaccine is interception. Okay, good. Chalo. Now, again, a few more questions to go. Statistical diagrams, we cannot mess up. Answer though. This is a very famous question. Okay, a famous repeated topic or MCQ you could say, which keeps coming, guys. Trend of diarrheal disease can be plotted on. Very good. So whenever you see the word trend, okay, that's the buzzword you should know. Whenever you see the word trend, answer is line chart. Okay? Trend. Trend of a disease or incidence of a disease. Okay, incidence of a disease. So how can you represent it? By a line chart. Okay, so when you see the words like trend of diseases or incidence of diseases, you can use a line chart. How does a line chart look like? See, with time you will see that number of cases kind of increase. So it is something like this. Okay, it can increase, decrease, increase, decrease. So this is your line chart. But what does an ogive do? What does your ogive do? So if you see the word cumulative incidence, Okay, if you see the word cumulative incidence, all right, if you see the word cumulative incidence, or you see the word constant addition of cases, okay, constant addition of cases, or you see the words like cases of a disease continuously increasing, cases of a disease continuously increasing. So what is the graph that you're going to use over here? If you see the word like cases of a disease continuously increasing, okay, or you see the word like recurrent cases, okay, recurrent cases of a disease. So this is ogive, okay, or ogive is also known as what? Cumulative frequency curve, okay. So it is like this, the cases of a disease are continuously increasing, there is no dip. But when will your answer be histogram and when will your answer be bar diagram? So again, a buzzword for your upcoming exams, if they write frequency of continuous variables and if they write frequency of discrete variables, okay, if they write frequency of what is the answer? Frequency of continuous variables के लिए we have what is known as histogram, okay, for continuous variable. And how does a histogram look like, everybody? There is no gap, okay, because it is representing continuous variables. And frequency of discrete variables is given by bar diagram. So continuous variable का example बताओ, like you have height, okay, like you have weight. They are all continuous variables. They can take up an in-between value also, right? They can take up an in-between value. Weight could be 20 kg, 20.1 kg. So they can take up in-between values. But discrete variables like gender. Gender can be male, female or transgender. It can't be in between. Religion, blood group. So that is expressed by bar diagram. Okay, please remember this. And if I ask correlation between continuous variables, correlation between two continuous variables, what will be the statistical diagram here? If the word is correlation, pictographs, you mean pictograms, Soumya? Pictogram is something which is used to educate a layman person, okay. So like babies, we want to teach mathematics, we can use a pictogram, all right. So that is a different thing, okay. And if you see the word correlation, correlation के लिए you will use the word scatter diagram. Okay, remember that. All right. So frequency of continuous variables, histogram, frequency of discrete variables, bar diagram, correlation between continuous variables, scatter diagram. ठीक है? All right. One more. Let's do it. Two more questions. Pie chart for food. ऐसा नहीं होता है. देखो, pie chart कब use करते हैं? I'll tell you. Pie chart we use, let me write it here. Pie chart you use when you can express something in percentage and proportions. Okay, like if you say balanced diet. Okay, if you want to teach someone about balanced diet, you can express in terms of percentages and proportion. Can you or not? हाँ? जब हम लोग pie chart use करते हैं. Like in our diet, we should have 10 to 15% protein, 15 to 30% fat, 50 to 70% carbohydrates. You can express it in terms of percentages. So when you can express something in terms of percentages, we use a pie chart. ठीक है? Yes. Mutually exclusive and 100%. Yes. Percentage and proportion. Just think, can you express it in terms of percentage and proportion? All right, what is the answer to this? Very easy, but it's important for FMG exams. Measures of central tendency are very, very important, guys. What is it? Yeah, I think you've written the answer, right? Frequently occurring value is mode. Okay. What is mean? I've just told you sum of all observation. divided by the total number of observations. Now suppose I give you this data set. Can you calculate median for it? Can you calculate median for this? Please don't worry about geometric mean. We are only concerned about the arithmetic mean. Can you calculate the median for this data? 21314. What is the median? Do it carefully, guys. Do it carefully. What are you forgetting? Everybody, anybody with a different answer? Very good, Subhash. Vinay, you cannot forget to arrange in ascending or descending order. That is why I asked you. Median क्या होता है? Median is the middle value when what happens? When data is arranged in ascending slash descending order. So let's first arrange in ascending order. Don't think middle values are 3. No. 1, 1, 2, 3, 4. So what is the median? 2. Okay. So it is the middle value when data is arranged in ascending or descending order. So median over here becomes 2. But suppose the question was this. Now can you calculate median? Now, can you calculate median, everybody? So here, what is the total number of observations? 1, 2, 3, 4, 5, 6. Okay, 6 is the total number of observations. And here, what is the total number of observations? 5. So 5 is odd and 6, everybody, is even. Right? So when it is even number of observations, again you will arrange in ascending order. That will be 1, 1, 2, 2, 3 and 3. Yes? You've arranged in ascending order. Now you have to take the average of two middle values. Okay, what will you take? Average of two middle values. So two values are here, two values are here. So average of two middle values means 2 plus 2 by 2, 4 by 2, which is 2. Please don't forget to arrange in ascending or descending order. And when you have when you have odd number of observations, no problem, middle value. But when you have even number of observations, you have to take the average of the two middle values. Okay, all right. 2.5 nahi, 2. And what is the mode over here? What is the mode? So mode is always the most frequently occurring value. Okay, let's do one last question for the day. Very, very important. A 36-year-old male presented to the OPD with difficulty of breathing while walking, back pain, unable to perform sexual activity, and excessive laziness. On examination, his body weight is 106 kgs, which is height independent obesity indicator. This is a very important topic. Please remember. Very good. Height independent is corpulence index. What is corpulence index? It is actual weight. Yes, corpulence index is actual weight upon desired weight. Okay, please remember that. So let's just quickly see the indicators for obesity ones. See, now corpulence is actual weight upon desired weight, height independent hai. The cutoff is 1.2. Okay, if somebody is less than equal to 1.2, it's okay. But if someone is more than equal to 1.2, the person is overweight or obese. Now look at the first one. Quetelet index is BMI. What is BMI? Weight in kg upon height in meter square. Now, you just think what your weight is. Ponder. Okay, you ponder. Ponder means you think what your weight is. Okay, I'm telling you, Divya. See, the first one we all know, whenever it comes to obesity, we have to calculate BMI. And what is BMI? Quetelet index, right? Weight in kg upon height in meter square. फिर तुम क्या करो next, what you can do is you just have to ponder or think what your height is. So it includes height. Here what has happened, height in centimeters by height को ऊपर कर दिया है न्यूमरेटर में, height in centimeters by cube root of body weight. Okay, height in centimeters by cube root of body weight. What is Broca's index? Broca is height in centimeters minus 100. Now formula is always supposed to be very long. So the long one, height in centimeters minus 100 minus height in centimeters minus 150 by 2 upon women or 4 upon men is for Lorentz formula. Formula हमेशा बड़ा होता है, right? Formula is very long. So that is therefore this becomes Lorentz formula becomes the longest one. And then you have what, guys? Corpulence index. In corpulence index, it is height independent. Okay, so please don't forget this indicator of obesity. It is very, very, very important. What are the various indicators of obesity? Okay, so height independent is corpulence index. Okay, all right, one more last question. Incidence is best measured by, so of course we cannot omit epidemiology, guys. It definitely comes in your exam. So a simple question, incidence cohort. I'll just put out some golden points. Okay, I'll just put out some golden points. Okay, incidence cohort study, prevalence with study, cross sectional study, multiple exposures with study design. multiple exposures के लिए backward, so case control. multiple outcomes with study, cohort. Exposed, non-exposed, go forward. Okay, all these are buzzwords. ठीक है, rare diseases, case control. rare exposures, cohort. And rare investigation should not come, but still rare investigation is nested case control. Okay, so I mean these are just some golden points for you to remember for your exams. ठीक है, all right, okay, so that's it for today, guys. I will meet you again for another set of questions. Okay, we will be looking at 40 to 50 questions for in these coming 2 to 3 days, guys. So please don't give up right now. Keep studying, and it's just a few more days to go. You've already treaded this long journey. So just the last few days. Please don't give up. कल होगी रचना, ठीक है? Look out on the Telegram group for the link. It will be shared on Unacademy group also. Update class is ready. I'm just not able to take it. I will be recording it, and I think I'll be putting it out. They've okay. It's there. I have to just take it. I think I won't be able to take it as a live class, but I will record the updates and in one class and put it out maybe hopefully by tomorrow. I have been trying to do it, but मैं कर दूंगी, ठीक है? कोई बात नहीं रचना, एक काम करो, टेंशन मत लो, ठीक है? जो क्वेश्चन तुम्हें समझ नहीं आ रहा उसको मुझको भेजो ऑन टेलीग्राम ग्रुप. लेट मी सी व्हाट इज दैट क्वेश्चन एंड लेट मी आस्क यू हाउ यू आर ट्राइंग टू सॉल्व इट and then give you the correct approach. Okay, is it clear रचना? Don't worry. हमें बिफोर द एग्जाम्स हमें हमेशा लगता है ये सॉल्व नहीं हो रहा, टाइम नहीं है, सबके साथ होता है. Don't let that overpower you. Okay, you know it all. Just try to send me 1 or 2 questions which you are not able to figure out, and I'll send you a message on how you can deal with it. अभी ये सब बिल्कुल मत सोचना कि ये नहीं कर पा रहे, वो नहीं कर पा रहे. अभी you just have to say that you will be able to do it. Okay, everybody does it, you will also be do it. Okay, don't worry. all these feelings come. Okay, but just keep revising, don't give up, and don't waste your time. Okay, bye bye guys, have a good day, and please be safe with the changing weather. Everybody is falling ill around us. Please don't fall ill. Be safe and take care of yourself. Okay, health has to be your important priority. Okay, bye bye, I'll see you tomorrow hopefully. Okay.